Countries discovering new cases, nations screening arrivals, and the WHO sounding a warning. If all of this sounds familiar and alarming, you're not alone. It's been a year or two since we recovered from the global pandemic, but should we be preparing for another one? The virus in focus this time is Mpox. It's usually endemic to Africa, but right now, it's spreading across the globe. Pakistan has logged a case, so has Sweden. Is India at risk too? In fact, wherever in the world you're watching us from, should you be worried? Our next report tells you.
PHEIC, a public health emergency of international concern. That's what the WHO is calling the Mpox outbreak. Pakistan has logged its first case. It was in Khyber Pakhtunkhwa.
The health department is ensuring all measures regarding prevention, control, management and facilities. We have alerted our border health services teams at the borders to check all the passengers and screen them for any symptoms. Any suspected patients found will be isolated and managed in Peshawar.
So has Sweden. China will screen its arrivals. If this is sounding like déjà vu, you're not wrong. Will this turn into a pandemic? Should the world be alarmed? And how dangerous is Mpox? First, let's look at the virus. Mpox was first discovered in 1958. It was in a colony of monkeys. It was known as Monkeypox before. In 1970, it was documented for the first time in a human, an infant in the Democratic Republic of Congo. Outbreaks were mostly sparked by people catching the virus from infected animals. Symptoms include fever, muscular aches, and large boil-like skin lesions. Until recently, it was mostly an endemic in Africa, but that changed in 2022. It spread across the globe. The WHO declared it a public health emergency of international concern. That was lifted in 2023. From 2022 to 2024, there have been over 99,000 cases of Mpox and 208 deaths recorded across 116 countries. Now, there are two subtypes to the virus, Clade 1 and Clade 2. Unlike the 2022 global outbreak, the latest surge is driven by the Clade 1, which is deadlier. Plus, it has a mutated variant, Clade 1b. It causes death in nearly 4% of cases. So, if it has been a public health emergency before, why the panic now? It's because of this variant. It seems to be spreading rapidly and very little is known about it. It moved from DR Congo to Rwanda, Uganda, Burundi and Kenya, and then outside Africa's borders. So, what happens now? Do we lock down again? The WHO says there's no need right now.
From the IFRC side, we do stand with what is recommended under international health regulations, which is that there's no need to close borders when we are in disease outbreaks. Diseases don't recognize borders. People will continue to cross a border, whether it is a legal crossing or not an illegal crossing. It doesn't stop a disease from spreading.
So how big is the risk for India? With global travel at its peak, cases are likely to reach other countries. During the 2022 outbreak, India too reported cases of Mpox, so it could happen this time too. Which brings us to the cure. How do you treat Mpox? Are there vaccines? Currently, at least 2 vaccines are in use. They are recommended by the WHO. But the available vaccines have largely not been made available in Africa, those most affected by Mpox. But there is a plan to secure 10 million vaccine doses for Africa. As for how worried you should be, Mpox is not COVID-19. It's not airborne. There are also proven vaccines. While all of this will help to stop its spread, the challenge now is getting the medicines and vaccines to Africa, the continent that needs it the most.
Across continents, one powerful news source.
bringing you diverse perspectives on the issues that matter.
We go beyond the boundaries to give you that little extra about every sporting moment.
So thank you for making Firstpost 5 million strong. We're counting on your support, and you can trust us to bring you the news unfiltered and unvarnished. On this today, the T20 World Cup bandwagon has moved across to the West Indies. What can you expect from this?
Hello, I'm Alison Green, coming to you from Durban, South Africa. Today we have a special show.
Start with a report on India's shifting nuclear posture. For the first time since India officially became a nuclear power.
Hello and welcome to Firstpost America. I'm Aaron Ham, coming to you live from the nation's capital, Washington, D.C.